causing biological effect to the selected area. Just understand this and try to know, this is the concept actually of HIFU. I highlighted non-invasive, frictional heat, initial cavitation, and biological effect. Yeah? Now, non-invasive. Why the HIFU or LIPOcel for this matter is called non-invasive? First, because it bypasses the epidermal and dermal layer. That means because of that criteria, it becomes non-invasive. There's no damage on the upper layer. It's non-ablative at all. It focuses only on the subdermal and adipose tissue. And why it becomes non-invasive as compared to the other brand or other machines? They have a contact cooling of 5 degrees. So that HIFU probe, if you were to touch that, it's very cold. That actually the purpose of that contact cooling is to protect the utmost layer of your skin. Frictional heat. So it's non-invasive, it causes frictional heat. Why? Because of the, again, we come back to the concept of ultrasound, the sound wave movement. It can cause vibration because it goes to the certain medium or molecule, vibration and rotation of molecules in the tissue. So because of this, it causes frictional heat. So this frictional heat, the intensity is based on the duration, normally 56 degrees up to 70 degrees in 1 second. This is how ultrasound delivers heat on that particular area. And then we talk about initial cavitation. This is another concept that we need to understand. Ultrasound wave rarefaction. Just now I share with you the sound wave rarefaction, where the compression, where's the peak of the sound wave, and when it goes down, that's the rarefaction. That rarefaction causes negative pressure to draw out gas from the tissue solution, which is adipose tissue for this matter, to form bubble, subsequently burst and cause initial cavitation. They always give analogies of a rotating blade of a motorboat, actually. So the faster you go, you're going to see a lot of bubble. Imagine that bubble, because of that sound wave that going so fast, high frequency, it causes development of gas in that adipose tissue, in that cell. So that bubble becomes bigger and bigger until it bursts. This is what we call initial cavitation. So just to conclude a little bit, actually, when we use or introduce HIFU, the first thing that happens, the heat is going to be there. And secondly, initial cavitation. The burst of that bubble cause another effect that's going to damage the fat cell, or that can cause apoptosis to the fat cell. And according to the study, some say that it can go up to as high as 1,000 atmosphere pressure, which is very high. So if somebody were to ask any of you or ask me, what's the difference between this machine and certain other machine? Because they have two effects. One, most of the treatment, they are quite pleasant to do because they only have the initial cavitation effect, but doesn't have that heating effect. LIPOcel, because they can go up to 1,000 watt, it tends to give that frictional heat effect. Yeah? And what about the biological effect? Once we have that initial cavitation, frictional heat, what's going to happen is that rupture of fat cell. This is the acute effect. You're going to have coagulative necrosis of fat cell, which is also the acute effect. Yeah? And what is the chronic effect? Collagen contraction. How does this happen? This is, again, I think in the morning they were talking about RF, radio frequency. We know that radio frequency, how does it work? Because it generates heat to that certain layer. We are targeting on the dermal layer. We are talking about radio frequency. But again, in your adipose tissue, they still have a collagen band over there. So this also can cause what we call collagen or protein denaturation. And subsequently, it's going to have a contraction effect. Yeah? And I just want to highlight, I discussed this morning with Dr. Anush, actually, why RF as compared to HIFU. For me, certain times I would love to do RF alone, because it gives me an immediate effect. I hope by now we understand that the immediate effect is because of the denaturation of protein, not because of the collagen that accumulated throughout the time. It's always a wound healing process. We learned this in medical school, 4 weeks actually, wound healing process. That's where the collagen start to come in and to develop and to thicken our collagen or dermal layer. Same goes to this actually. So when we introduce the so-called control injury, which is denaturation of protein of the dermal layer, or in this case in the adipose tissue, it's gonna have a contraction effect, which gonna takes you about 3 to 4 weeks to see a good result. Yeah. So it will take some time. And okay, this is again a common question. A lot of even patient we ask you if you were to do LIPOcel, what happened to the fat cell? Logically, you are damaging the fat cell. Of course, there's the content that need to be eliminated. So imagine this is not ultra shape. Sorry, I should cover that. But whatever HIFU treatment, so there will be a fat cell disruption or apoptosis or damage of fat cell. You're going to see a lot of fat cell coming out. So the cell membrane and the content will be taken in by macrophages, become cell debris. There will be triglyceride part of it with the help of lipase enzyme in our tissues. It will be divided, or it will be break down into glycerol and 3 fatty acid. Then only it's going to go to lymphatic system to our liver. And study shows, and it's not only for this matter, or in fact, like a few other companies also have been doing the same studies to see the serum level of the patient. They notice that there's no changes at all before and after the LIPOcel treatment or HIFU treatment. And in fact, because they have glycerol, and this is processed into energy and fat, I keep telling my patient, probably you're going to feel energetic because you got glycerol over there. So probably another indirect effect of when you do a HIFU treatment on the patient. Okay, when talk about adverse events from my study, this is one of them. You're going to see ecchymosis. You're going to see some bruising also, but it will resolve within 3 to 4 days. The most is about a week. And just to share with you, this is LIPOcel, one of my patients. And I also do a lot of tumor cell liposuction actually in my clinic. So this is conventional lipos. You can see the result is almost the same actually. And that's why I do believe that HIFU technology does work on patient, provided that we know how the effect or how does it works in terms of application of the machines. Okay? Okay, now this is the end of my first presentation. Can we go on the second presentation? So what I'm trying to say actually while they are changing this, before we even do, there's no such thing as plug and play actually. I hope all of us, I mean like the doctors especially, always think that to differentiate doctors and the beauty therapists is the knowledge part, the education part. This is where I keep on emphasizing to every doctors actually, that you guys, we actually need to know, we need to dig in again, read a little bit more on the studies, the theory behind that before we do the procedures to the patient. Again, this is definitely going to prevent any adverse reaction, or even it's easy for us to manage any adverse reaction if we were to know the treatment. Okay, this is a multi-center study. I did 2 studies. The first one is in 2016, which we do on the abdomen and flank, because at that time they only have 1 probe, which is about 13 millimeters or 1.3 centimeters. The second studies that I did is a multi-center study. This is to combine result from 4 countries, Malaysia, Japan, Korea, and India. Yeah. So, and at that time, actually, we got a few issues in the sense that some says that the treatment takes sometimes. It takes hours. It's very tiring for the doctors to do. So we decided to challenge that to see whether if we were to do this with a shorter period of time, shorter pulses, whether the result is good or not. So we know that the efficacy is insignificant in adverse events. We did our case study. We know that the outcome is good. Again, the long treatment time is an issue, and the rationale of study is to know whether the same outcome can be achieved with shorter treatment time. We also introduced a shorter depth, because at this time we got an 11 millimeters probe to cater the thighs area. Of course, the purpose is to see is there any changes on flanks and thighs area with shorter treatment time using LIPOcel device, and also to observe any adverse events of the treatment. This is done recently in June and August 2017. Non-randomized convenient sampling, 4 different countries, as I said before. And measurement taken baseline after 2 weeks and 4 weeks. So this is where, for me, it's a good challenge to see whether HIFU or LIPOcel really works with a very short period of time. We only do 2 treatments, one after day 1 or baseline, and the second one after 2 weeks to do the treatment. Well, this is an inclusion, of course, BMI between 18 to 30, visible fat under abdomen. They are not supposed to do any weight loss treatment during that period, the trial period. Agrees to maintain their weight, yeah? Plus minus about 2 kilograms. And exclusion, of course, BMI not exceeding 30, not taking any pill or diet, and they are not supposed to be pregnant or lactating. Now, the method, we are using 13 millimeters, and this, how ridiculous is this trial? Actually, what I got from the company, they said, Dr. Ungku, we're gonna challenge the machine actually to see the outcome. So they said, why do we do flank, 1 stacking, only 1 session, and 8 sites on each side of the flank, which in total is about 4 minutes actually to do the procedures, because 1 shot is 30 seconds. So both sides is 8 minutes actually. So that's how short the treatment is. But total treatment time is 4 minutes for 1 side. Yeah? Sorry, total shot is 8. 4 shots of every flank. So that's how crazy they challenge us, or me actually at that time, to all the other countries or the doctors in this trial. And then for 11 millimeters, we're going to do 15 shots on each side. In total, 30 shots, and the treatment time is 15 minutes. And the primary outcome is the reduction of abdominal circumference between pre-treatment and 4 weeks post-treatment, and reduction of thigh circumference between pre-treatment and post-treatment. The secondary outcome, of course, from the Global Aesthetic Improvement Scale determined by a physician. And this is what we got. This is from Malaysia. We do it on 5 patients. We noticed that for flank, even though it's only, remember, 4 shots on each side, 4 shots on each side, it only takes me, as I said, 4 minutes to do the procedures, but this is the reduction that we had within 4 weeks. So, and we are using 13 millimeters probe. And then we're going to go to Korea. This is also, we got -5 over here, which is tremendously high, which I think the result is good, is fantastic. And then India, we also got -3.5, -3 reduction of abdominal circumference. And this is Japan, also almost the same outcome. So you can see, even we have a shorter time, we do only on the flank area, there is significant outcomes. Thighs, this is another thing. However, thighs, I think during that time when we do the trial, and I have to tell the truth, and again, sorry to say this to the JC's company, I'm just reporting what I can see. When we do on the 11 millimeters probe, result is not as good as the abdomen. However, I noticed probably because of the selection of area, that may be the cause of that. Because when I did on the patient, I noticed that actually the one that have the highest reduction is the one that we did on the very specific targeted area, especially on the inner thighs, not on the upper part of the thighs, not on the lateral part, because you won't see that much of result. Same goes with the with Korean studies. They have the minus 2.8 is the best, but some of them there's no reduction at all, zero. Yeah. And this is India. They got 2 studies. I think one of them, this is also zero. And this is Japan. Japan, I think, yeah. I got 1 plus 0.5. And when we check back to the doctors, actually, again, the area of where they put the probe is slightly different from what we anticipate. So this is the photos that we can gather after doing this. This is after 6 weeks. 1 stacking, as I said, only 4 shots on every area. This is the result also. 4 shots, you can imagine how ridiculous when they put us to challenge the result. It's only 4 minutes to do the procedures, but this is the result we got. This is after 6 weeks on the thighs. This is abdomen, on the flank also. This is also. This is also for the inner thighs. This is the flank area. This is from India, I guess. Is it from you, Dr. Anisha? So this result also is fantastic for me. I can see that the outcome is that, but I guess this is done a little bit more than the flank area. I think Dr. Anush did do some treatment on the abdomen area for this method. This is a special case. So you can see reduction is 3.5, which is a lot actually. This is from the side views. This is again, I'm repeating the adverse events that I had. So initial study shows that there are significant changes in the abdomen, even though we are using a very shorter time. And previously, we need to do up to between 30 to up to 90 minutes to do on the procedures, which I will explain a little bit more detail during my last presentation slide. Flank result is fantastic. Adverse events is still the same as the first study that I did, erythema, ecchymosis, and procedure pain in all moderate, which is moderate. 2 post-procedure pain that lasts for a few hours only. Again, this is just to share with you the result before and after doing the treatment. So, for me, again, I have to show this, sorry, because the secretariat of this conference want me to show this. This is for next year for those who are interested. But anyway, the reason why we did this study is actually to share to the whole world that the effectiveness of LIPOcel, and again, in practice, when you were to see your patient, I think the most important thing is to make sure that you can challenge, not to the patient, but yourself, that this technology works to the patient. Yeah. Can we have a last slide? Yeah, the last presentation I got. It's okay. I think we have enough time. Yeah. The last slide, the last presentation slide is, I guess, is more important and more interesting, I hope, because this is where, once you know, I presume that you know the concept, you understand how it works, you have already seen the clinical study, clinical trial, and the last one is to know how to use it properly. This is where most of us will notice that some of the doctors are going to see a good result. Some of them will come back to you and say, oh, I don't see any result at all, which I think that's the reason also why we are here today, to share our experience among each other, to learn together. And I believe that like some of the speakers this morning, I guess the fact that they are willingly to share what they learn, what they know is priceless. Because I'm sure some of you guys know that some doctors who succeeded in doing the treatment, they won't share how they do the treatment. I just keep it to myself and I don't want to share. Why should I share with you? You're going to have more patience than me. So I guess, you know, they are quite good in that sense, just to share. And I believe that by sharing, actually, it's not only you are imparting knowledge to your colleagues, you are also gaining a lot of knowledge back. I believe in that. And okay, this is LIPOcel effective application. And I share this joke to some of the doctors, actually. I know we have dermatologists, we have plastic surgeon, we have certain subspecialty, but I just enjoy sharing knowledge. So I decided to take up Master in Education, actually, just to teach, actually. I hope that I can bring some benefit whenever I give my presentation. So this is my SOP. Why I call it my SOP or standard operating procedure? Because I believe everybody have their own SOP, which I'm not going to dictate on that. But the most three important thing is pre-procedure, procedure, and post-procedure. What are the things that we need to know? What are the things that we need to share so that we need to do before we can get a good result? Again, this has been emphasized again and again. Sunny? Sorry, I think that my practical session is very fast. So can I just complete this? I think this is important. Once they see this, they know what to do, I hope. So, okay. Consultation is most important. Again, please make sure, in fact, before I go any further, when I talking about doctors, younger doctors, actually, the fact that I love to teach, and I have about 400 over doctors that train under this academy. So I keep telling them in aesthetic, the number one integral component in your treatment is a consultation. I believe that it consists at least about 70 to 80% to make sure that the result is good, to make sure that the patient will be happy with the outcomes. Yeah? So as usual, the reason is important. You need to know. And make sure that they don't give you or come to you and ask for a miracle result, you know, within 3 days or within 1 week, I'm going to see the result. Expectation should be there. And most importantly, lifestyle change. Lifestyle change doesn't mean that we're going to ask the patient, when we want to do LIPOcel treatment, we ask the patient to go on diet. No, it's not that. Lifestyle change meaning that they need to know that when we do certain treatment, they need to help themselves, not us, that in order for the thing to work, they need to make sure that their food, their diet is properly done, there is some exercise regularly so that the whole process is going to take place and they're going to see a good result. Most of the time, what I can see in patients, when they come to you, they are challenging you again, or challenging the treatment. For example, if I were to come to Clinic A, I paid 10,000 or maybe 5,000 US dollar. I want to see result, and I will eat like nobody business because I already paid that much money. So I don't know whether you find that in your practice. You know, I don't care. I go to this new technology, HIFU. I just want to have a very good result without having to care about my diet or my exercise. So they need to change their lifestyle. Remember that I got a few patients who got frustrated. They said that I'm becoming fatter after I do certain treatment, not LIPOcel for this matter. Otherwise, I'll be scolded by Mr. An. No, but some treatment, you know, like RF or certain Zerona, for instance, they will want to see good result, but yet they themselves doesn't want to change their lifestyle. And I believe now, because public are more literate in terms of the technology. So what you need to do as a doctor, I believe that the understanding of the concept is paramount. It's very important. This is also to avoid any litigation or, you know, unsatisfactory complaint or remarks from your patient. And you know, nowadays with the social media thing and everything, they need to just viral whatever happening, you know. They will just say that I go to Dr.Ungku clinic and I do this treatment for this much, but I don't see any result. This is what we don't want. You know, it will tarnish your, the reputation actually. But I believe that if the patient were to know their, what you call the procedures, like what I explained just now, try to change or convert that into a layman term so that they can understand what is it all about, how does it works. You're gonna tell them that it's gonna take you about 4 weeks to 6 weeks, madam or sir, then only you're gonna see good result. And tell them why does it takes about 4 weeks to 6 weeks to see the result. Probably, I guess, in fact, instead of challenging your treatment, the patient, they will help you. You're gonna see a good result after the end of the procedures. And this is what I do, my personal experience. I will take about more than half an hour mostly, just to explain on, not only on HIFU or LIPOcel treatment, on any treatment, just to make sure that they understand what they are dealing with. And again, this is where we are different from the beauty therapists. Yeah? We need to know what is it all about, able to explain. Again, during patient assessment, we need to know their BMI, age, localized fat, blood disorder, medication, and whether they are pregnant or not. And this is also important, the BDD, whether they have any psychological issues. In my education program, we purposely put 2 hours, we call a psychiatrist, to give talks to the aesthetic practitioner about all the psychological disorder, because you need to, I know that most of the doctors already learned this, maybe we forgot what are the symptoms and signs of neurotic patient. So this type of patient you need to eliminate. Make sure that they are not your patient. And of course, for LIPOcel or for HIFU technology, give them size, S, M, L, and XL. It might be funny, but this is what you need to do, because the size we determine is equivalent to the number of shot. Number of shot is equivalent to dollars, equivalent to the cost that you're going to charge the patient. Yeah, of course, consent is important in any aesthetic or medical procedures. Measurement. This is also another important aspect, which, again, effectiveness challenge. You need to make sure that you believe that this thing works, but how you want to know that it works? By measurement, precisely. I personally, I will do the measurement myself. I don't let my staff to do, because I don't want, you know, I got, let's say I have 4 staff. 1 staff will measure in different way. The measurement part is important. You need to know how to do the measurement. I can share with you, anybody want the measurement, even the template, how to measure that, I can give it to you for free, don't worry. At least you know how to measure, because this is important, even to do any trial. So, and especially for the patient, psychologically, when they see that you are taking that extra effort to measure properly, they know that you are serious in this treatment. Of course, the effectiveness, this is optional, you can do that. The best way to measure effectiveness is using ultrasound to know the effectiveness, the image, or you can use a caliper type, which is not that precise. I don't like the caliper type because the pinch to know the effectiveness varies, depends on the operator. Pictures is important. Of course, the global aesthetic improvement scale is easy to know. All the physicians should know how to do this using the Likert scale. Yeah, you need to know this. This is one example of how I do my measurement. You can see that that's the circumference. I will make sure that I will pick the highest peak of the abdomen. If you were to see a patient from the lateral side, I'm going to point, okay, I'm going to mark the highest peak. That's going to be my marking. And I'm going to do the measurement around the waist, around that highest peak. I'm going to take the measurement. And then also you need to know the height from the feet, from the ground until to that layer, that level. You're going to take 3 measurements, so that the next time you come in, you're going to use the same measurement. Then only you're going to mark the highest point again, whether you're going to see any difference or not. Of course, it differs from the thighs and also the upper arm. I can also share with you. But you can create your own template, how you're going to do the measurement. But this is very blur, but never mind, I can share with everybody. I can email to everybody on the protocol, actually, or the form. And determine the parameter. I will go one by one because some of us, for those especially who never experience or never know what is LIPOcel is all about or HIFU is all about, they need to understand certain parameters. You know, like just now we are talking about intracell or ultracell. Some of us probably not sure, you know, when they talk about, some of the speakers were talking about the distance, this and that, which is very good, actually. First, number of shots. We need to know operational definition of number of shots in LIPOcel is that the number of time operator press the switch on the probe. It consists of multiple sub-shots, actually, targeting the intended level within the probe area. That's not me. I'm not doing that.
Yeah, just raise your hand.
Yes.